But remember, we're all human and we've all tried to do our best with the information we had at the time. But we're also professionals, and that means we don't stay stuck in what we believe to be true. When there's new evidence and new science that comes forward, we have to be willing to change for the benefit of our patients. I have been targeting hygienists because I want them to take more of a leadership role in the office with that. I would love to see a world where a dental hygienist would feel comfortable, pick up the phone, call the patient's primary care provider, ask to speak to the nurse on the other line, and give a report on their patient that they shared together. I want to bring hygienists to the nursing conferences. I want to be having these conversations on the big stage in front of those groups because I guarantee you it's going to blow their minds.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 207. This is Andrew.
This is Michelle. And I just love when you are like, get into it. I don't even think I took a breath before you're like, hello, everyone, welcome back.
Dancing right now. Also, I'm just so gung-ho about doing this right now. And I love catching you off guard because that's fun for me.
Good for you.
To clarify, though, and if we are being absolutely fair, you are the one that counted in 3, 2, 1, record. So, it's not like you didn't know it was coming this time.
But we also do like, are you good? My stuff's going. We're good. Like, we confirm before we get into this intro.
100% of the time we do that, except for this time. And you're welcome. Welcome. And Merry Christmas, everybody. Ho, ho, ho.
And happy holidays and happy New Year and all those things that happen for whoever's out there. And welcome back to this little old podcast of ours. If you're just tuning in, welcome. You're getting started for a really good 2020. And we're actually recapping, which is really fun, this year.
What a wonderful year it's been. What a crazy year it's been, this graduation year of 2001.
We're going into a new decade, man. That's crazy.
I feel like we're writing in our yearbook right now. Like, it's been a crazy journey. Yeah, no, it was good. You know what? I think that we've learned a lot this year. Not just all the educational content from the podcast world, but I think that we learned a lot in business and business development, which, hey, we came a long way there. I think we learned a lot and I don't mean this in a bad way because it is going to come out kind of like negative, but like selecting your friends and selecting your circle and selecting the people that are going to be loyal to you and you're going to be loyal to them. No matter who's talking smack or who's saying this, that's the unfortunate part about as you get further in the business world, it's a cutthroat world. And you and I have said it from the beginning, look, we just want to be inclusive. We want to be helpful. We want to be informative. We just want everyone to be, if you have something you want to share, let us know. Let's get it out there for people to hear. And I think that's kind of been our driving force from day one. I've really appreciated kind of seeing some of these full circles of friends coming through and being way over the top nice to us. And, you start calling out names, of course, and we're going to forget too many, but, I'm thinking specifically like Cherie, right? Cherie Lipinski, you think of that type of a person who is just so loving and inclusive and wants what's best for the world, very similar to kind of what we want. It's been wonderful. I like 2019.
It has been. 2019 has been a good year. I will say for me personally, it's been an uncomfortable year of growth.
I've loved watching your uncomfortable year of growth.
I don't think that's completely true, but I appreciate you can say that now because you and I have both had personal growth. And this wasn't always coming from me too, because I was in this up and down, lots of life changes, a major surgery, all these things have happened this year and I did not enjoy it. And I don't think I was very kind to you in some of those moments.
But don't you think that that's what the relationship's about, right? Doesn't matter if it's friends, business partners, which we happen to be both. So thank goodness for that. But like, you know, any sort of relationship that you have, like you talk about your parents or your significant others, or even your dog Lola's loyal to you and loves you no matter what. But look, like sometimes like dogs get a little bit annoying. Like they're just too needy, or they want this, they want that. Like there's always the ups and downs of a relationship. And I think that it's really a testament to you to push through, to see what is making you uncomfortable or upsetting you about such a situation and overcoming that. What I've really enjoyed about your growth specifically is communication. Like, look, I am terrible at communication too, but the fact that you like uncomfortably have these conversations with me, love it. Love it.
Well, I think also, you know, you are not a easily shaken person. Like you're pretty even keel, whereas I am not. So,
okay.
I think that's what balances us, where I can rage and be a maniac and then go, oh shit, I need to communicate that like better. And you don't hold that against me because you're like, it's whatever.
That's funny. I don't have anything to say that, but thank you. I'll take that as a huge compliment, because I think that there'd be so many people at work that disagree with my even keeled mentality or whatever. But yeah.
Well, but also a lot of people are insecure. And I'm not saying that specifically about the people that you work with, but I think what that is the nature of when you can't take it, or you feel offended by somebody, that's more your insecurity than them being offensive in a lot of ways. And actually somebody mentioned after they heard a conversation between you and I, like after I was like, I don't like this, what that's happening. And like you and I like talked it out and we had a really good positive conversation. And he was like, Andrew's really good for you. And I was like, yeah, I would agree with that.
Oh,
absolutely.
That's nice.
Because it's nice to have, people ask all the time, like, do you guys really get along? And I was like, well, it depends on the day of the week. Because
it depends on if she makes me do videos or not, or if I have to actually put my face on something, which I don't like doing.
And we're also such different humans, and even clinicians. Like if we take this back to the clinical thing, right? Like you and I are practicing hygienists, and I don't know what you and I would look like working side by side clinically.
I don't think that we would operate in the same office at all. Like only because think about like your skill set. Think about all of the knowledge that you have. I don't know a more talented clinician that can do all of the things that you do in the way that you do it. I'm like looking off into space. I'm trying to like rack my brain. Is like, am I actually missing someone? I don't honestly, and I'm not trying to fluff you up, because look, I have no skin in the game to make you happier, but you're so good at what you do. You know, all of the instruments, you know, all of the advanced instrumentation, that I couldn't hang with you. And so the office that you'd probably be in would be focusing and serving a certain population that I could not. I don't think that I would be good enough to service that particular population in a competent and great way. I think that there is a certain type of population that I am good at that you would also excel in, but you'd be bored to death with those cases because it's so easy compared to what you like.
But also you're in an environment where metrics light you up, and that's what you get to do. And also you get to put like meticulous anatomy in the occlusal surfaces. And I'm just like, gross. Like who cares? But there needs to be that hygienist out there that can do those kind of things. So I think you're right. Like if we were to work clinical next to each other, like, God, it would be so different. Like it would never work out. One of us would be so bored or not in our wheelhouse. And that's one thing that you and I talked about in that 10-year challenge, right? Like what we've learned in the last 4 years on this podcast, or at least what I have personally, is that there is not one right way to do dental hygiene. And coming into this podcast, I absolutely thought so. Like I thought that if you weren't doing it a very specific way and including a lot of things, that you were doing it wrong. And that's the other great thing about this podcast. Well, it's uncomfortable about this podcast. And I hope that people give us a little grace sometimes, because to have us learning and growing for thousands of people every month to listen to put ourselves out there is so uncomfortable sometimes.
Yeah.
but also like really great.
We were talking earlier about like the term dental hygienist, right? Like, what does that mean? And things like that. And I kept thinking about it. I've made videos before we did the podcast. And if I was to go back and watch myself on those videos with the knowledge set of back then, I think I was probably pretty okay, accurate-ish. But now with the knowledge I have now, I'm like, no, that's wildly off base. And so it's very similar. But think about how nice people are, like Joanne Grenlian, right? I'm just thinking about her. She's so smart. Amazing. She's so like way past where I'm at in my development, in my career, and my stuff. But yet she talks to me like an equal and as a peer when she could easily talk down to me. So I feel like we have these people in our lives that are just great for us and really helping us in our like kind of evolution as a hygienist too. That's amazing.
No, I agree. And I would very much compare our experience this podcast to like the Dunning-Kruger effect. And I've talked about this so many times, but it's when you first get out of like school or you start learning things and you are like, what you think you know is at the top of that X, Y, like, you know, your line chart. And then as you like learn more, it starts to steep down and you're like, oh my gosh, I actually don't know anything. And then it like kind of gets to a pit where you're like, I'll never figure all of this out. And then as you kind of get more experience, it starts to come back up where like, it's gray, you know, all you can do is keep learning, growing, taking it in. You'll never know it all, but that's okay as long as you keep on striving to know. Very early on, I was super dogmatic about a lot of things with my patients, with my education, with the way I wanted to work and who I wanted to work with. And now it's just, I know sometimes I'm still dogmatic, but I try really hard to, I don't know, see the other sides of things.
Look at you growing. Oh, I love it.
But it's uncomfortable and it's icky. And this has not been a great year for all of that. And it's very gross.
I know. I mean, it's hard for all of us, right? Like all of that growth. You think about, you just mentioned it, you know, the first year when you think you know everything, that's usually when, you know, these people are lashing out. You talk about insecurities. I feel like that's when you see on the Facebook groups, the nastiness really coming out, whether people are telling factual things or not, it doesn't really matter because, you know, they're just trying to like find their way in the world and realizing how little they know. And it sucks for them. And we, as a human race, are sometimes not equipped with, maybe like we all need therapists, but like we're not equipped with the understanding of how to approach those situations when we are uncomfortable. And so just generally, we just lash out and are just mean to other people. It's very bizarro. But let me say this. Let me just pull out of that negative thing for just a quick second.
Yeah.
I am so genuinely happy and pleased with all of the people who have come on this podcast this last year and the positivity that they bring to the profession.
So true.
And just wanting people just to be just one notch better. You're not ready for it yet? Come back and listen to me in a year on the podcast and then you'll be there. Like, oh, I'm so happy.
No, that's a good point to make. People come on this podcast and they bleed their content just because they want to make you guys so much more informed that you can go and care for the people, our communities. That's true. That's such a good point to make, that people are just so positive, and the people who lift us up and continue to lift us up and support us and who are out there like, stop doing this for free. It's time for you guys to like grow and be a big business. And so we appreciate that because we are so not that altruism. We bleed altruism when it comes to content.
We do. It's the purpose of everything. Like, you know, and I take it outside of dental hygiene too. Just like in my life, I've always been one where I'm like, I had a really great conversation actually just this week about finances. Like I'm doing okay financially, not, you know, as good as a lot of people my age, but I think I'm figured it out, you know, over the last 10 years. And now I'm in a place where I just need to kind of keep on keeping on. And if I keep on keeping on, then I should be all right. Well, I was having a conversation with one of our dental assistants about it, and she was teaching me so many things about all of the stuff and having this fun, uplifting conversation about like, let me share my knowledge with her. She's sharing her knowledge with me. Like we're teachers and learners at heart. And that's what it comes down to for this podcast.
That's a good point. And this was a really great end cap to 2019 because we started 2019 off with an amazing series that really kind of set the stage for all of our info for this year, right? And people still, when we go to conferences, are like, "Oh my gosh, that Airway series, it was so good." And that really, I think, set the stage for what's to come in what came in 2019 and what's to come in 2020. And so we appreciate Cindy Johnson and Julia Worrall for coming on and doing that series right off the bat in January. And what's fun though is that we're going to end the year with Julia. So I was just at the FAH or Collaboration Cures meeting. So it was like the AAPMD, a few other, I can't remember all the acronyms of all the associations, but there's a bunch of people that came together for oral systemic health. And so you've been hearing the last few weeks are all the people that I met there and did podcasts with. And so with Julia, we kind of are recapping what we learned and what has happened since we did the Airway series and what she's even learned since she taught us back, 11 months ago. So enjoy this end of year podcast with Julia Worrall.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
So I think this is going to be really fun because now you are bookending our year. So welcome, Julia Worrall, back to the podcast.
Thank you so much for having me.
So you started our year out with the Airway series, you and Cindy Johnson. It was one of our more popular series. Everyone really loved it. I mean, how many people have brought it up here?
Oh, many. That's so exciting.
It's awesome. So we are at the Collaboration Cures event with AOSH, AAPMD, ACAM, and there's more. I'm not going to even try to remember them all, but there's more.
6 groups.
So you're going to hear some stuff in the background, but I thought it would be really nice to end the year with more maybe updated information or even maybe just like validation for the message that we're trying to get across. Like, I don't know, just wrap it up for the year.
Yeah, I think that's a great idea because when we started talking about Airway and the importance of having the hygiene team, the dental team on board with screening for airway issues, I remember you and Carrie, I think we had a conversation about that.
One of many.
It seemed like a bit too much to take on. It seemed like a challenge to be able to assimilate the information. And I think if I was to summarize what I feel has changed the most over this past year, I would say it would be you.
What?
It would be you. Because when we first started talking Airway, and every issue you brought up, I was saying it was an airway issue, and you said it sounded too woo-woo.
I think my comment was, this seems like the panacea of health, and I don't believe in that utopia.
Okay, the other thing was you said you knew just enough to be dangerous.
Yes, I did. You've told me since not to say things like that.
Because just starting out, if you only know a little bit, it doesn't make you dangerous. It actually makes you powerful.
Yeah.
Because you can impart the little bit of knowledge that you have with your patient and tell them next time you see them, you'll have more information.
Yeah.
So I think seeing that change in you to go from somebody who was like, what? I don't know, to somebody who's a believer. And now you're like hungry for more information. I love seeing that transformation in people.
Yeah. And you're coming into our world, we're going into your world, and there's this very uncomfortable feeling when you're in that transition and trying to learn it all. And I definitely got to a point where I was like a little frustrated because I don't understand it. Like I understand a lot of my field and my profession. And then when you start to say like, I think grinding and bruxism is my big one. Like if I had to like put a issue that I have really had a hard time understanding in the airway world, or not understanding, switching my thought process on, right? Like, and that was because I grew up in that panky Dawson Academy world where it was like very specific, like you're getting it down to like the cusp fits perfectly into this fossa, and everyone should, it's a religion to be on a night guard. Like if you don't have a night guard, then you're not doing right by your patient. And then to hear like bruxism isn't necessarily all the dental things that we have been saying for a while. There's this whole other component. And in addition to that other component, you can exacerbate it by putting them on this type of night guard. And I've pretty much sold that to every person I've ever met in my life. And that's
uncomfortable.
It's very uncomfortable. It is.
It's an uncomfortable place. And I think each of us, when we get into this world, have a flash of the different patients that have come into our lives that we've given advice to. And if we're a doctor or a dentist, we've treated. And so it's really hard to assimilate this new information. Sometimes I think, why is it taking so long to make this transition? But remember, we're all human and we've all tried to do our best with the information we had at the time. But we're also professionals, and that means we don't stay stuck in what we believe to be true. When there's new evidence and new science that comes forward, we have to be willing to change for the benefit of our patients.
Yeah.
Otherwise, then we're not a safe provider. And it's not fair to our patients. They're trusting us to keep up to date.
Yeah.
And even for myself over this past year, one of the changes I've made in my conversation about bruxism is, before I would say, well, bruxism and that clenching of the jaw was an attempt to keep your airway open. And then I attended a conference with Gilles Levine, who's one of the world's leading experts in bruxism. And he said it would be very convenient to say that, and it fits our dialogue.
Yeah.
However, the science isn't showing that, because there's no symmetry between the drop in oxygen with the brux. It either happens before, it can happen after, it may not happen at all. So he was describing that there's actually two systems going on, similar to how we have with our mouth. We have the digestive system, but we can also breathe through our mouth. They're two distinct systems. They just happen to occur in the same space. And so with bruxism, it may be happening while we're sleeping, but one can be an airway respiratory type of issue, whereas the other one is a neurological issue. And so I want to learn a lot more about bruxism. I want to provide a lot more information about that, because he said that this is linked with Parkinsonism, and Parkinson's is coming up as one of the fastest growing diagnosed diseases of our age. And that's a very uncomfortable place.
Yeah, it is.
That if we're not intervening and we're not helping our patients to prevent that, because we think the important thing is to put some acrylic on their teeth so they don't break. But there's a bigger neurological issue there, then I want to uncover that, So I think one of the things I love about our worlds crossing over into each other's worlds is the learning curve. I love learning, and I'm excited about medicine again, to learn new things and not be in that rut of just doing every day what I already know. I want to learn new stuff. And this event that we're at right now, it's just mind blowing.
And, you're bringing up a point, because Ashley, if you're listening, she was in our course yesterday and she's been listening to the podcast. She was questioning, she's like, what? That's changed with the grinding and the clenching. And because that's not what we're hearing with other particular courses, especially when we're looking at airway, and how you can't just settle in and feel comfortable that now you know something. You have to reach out and get other people's perspectives and their knowledge, and so that you can incorporate it into what you're doing.
Well, even when we start teaching, and I find this a lot, and I would challenge other people who teach. When you start teaching and you get your program down and you have it flowing, and it's really a great business that you've got going on, sometimes we don't take other people's courses.
Yeah.
Because we're so busy putting on our own courses. So I think that you have to balance your time with what you're teaching and what you're learning. To never think that I've learned enough now, I'm an expert in my field, and so I can just start churning out my knowledge and my information.
That's an excellent point. And, we've also had the conversation here that we put our blinders on within our field and what we're experts on, and we don't listen to other people. And we also want to solve all that person's problems, all their problems within our scope.
Well, I'm guilty of that. I've been listening to Carrie Ibbotson, Cindy Johnson, Michelle Schrag for the last few years talk about pathogens and biofilm management. And I had a mental block up because I was like, that's not the issue. I'm thinking it's the sleep, the airway, the systemic inflammation from those things that's causing everything else. And I'm beginning to open my mind. And so I'm well aware of what your listeners are going through when they listen to me too, because I'm just beginning to let some space to allow that information to come in and realize that a lot of this is bidirectional. A lot of it, I don't know what I don't know. And this year, I want to spend more time understanding that connection between the pathogens and how it's affecting us, because I heard several presentations this weekend where these leading experts in Alzheimer's, dementia, neurological disorders, heart, cardiovascular, they're all beginning to link the pathogens. So I'm hoping this is going to be a really exciting time for dentistry to get up into that world.
Yeah.
To take their place in healthcare that we know they should hold. And I'm hoping we can help your listeners along the way to also to feel it and let it in. Because I do think that your listeners, a lot of them and where they work and how they've been working are a disenfranchised group in healthcare. So Uche Oriadu, I heard him this morning talk about when people lose weight and they look amazing, but they have that imposter syndrome. And so they gain it all back because they didn't stop to let it in that this is the new them, that they look hot. He really has got such a sense of humor, but it's true. Sometimes we're taking our place in healthcare, but we don't feel it. We don't own it. We don't let it in. So that is really important as we start taking on, as the dental community starts taking on more and more medical issues.
And you actually wrote an article it was RDH magazine?
Yes.
And it was called
Hygienists as First Responders.
Okay. And what does that even mean?
So as a first responder in the emergency department, first task is airway. So when that person's rolled in on the stretcher, somebody is assigned to immediately manage the airway. You're making sure it's open. You're providing oxygen. You're putting either some sort of tube to support it. Let's put it that way. But airway is the first thing we do. And so dental hygienists as first responders, I want them to be thinking airway. When they look in that mouth, is it patent? Is it open? Do we need to do anything to support that airway? And I want to trigger that mentality in them that when this patient comes in and sits in my chair, I have an opportunity to save their life. I have an opportunity to change their life, to prevent them from having all these debilitating diseases, cardiac death. I want them to start looking at themselves as that rather than I'm just looking to.
Let me put a scaler to that tooth and get that calculus off. Let me polish and get that stain off.
Yeah, you're so much more than that.
Yeah. 100%.
So much more. I do want to say though too, that although the title is dental hygienist.
Yeah.
I mean anybody in the dental office. Right? Anybody of the dental team.
We have amazing dental assistants.
The assistants, the front office, the dentists. I mean, the reason I pointed out hygienists is because a lot of the sleep courses I take, I see courses for dentists and assistants. And because the assistants help the dentist to make the oral appliances. And I think hygienists have kind of been left out of the loop in some of those learning opportunities. So I have been targeting hygienists because I want them to take more of a leadership role in the office with that. I would love to see a world where a dental hygienist would feel comfortable to pick up the phone, call the patient's primary care provider, ask to speak to the nurse on the other line, and give a report on their patient that they shared together. So I'm purposefully trying to empower that particular discipline. but all of the principles we're sharing and talking about apply across the board in the office.
So we actually had a little course together looking at hygienists and nurses and how we can work together. And one of the things that you did bring up was that if you were in an office, like you would call the other specialist and tell them what you saw. And we're talking in medical.
Right.
And I do that with dental too. So if I've always worked in perio, the specialist that was referred to, and so I always had a counterpart that was in a general dentist. So every single patient got a letter to the doc, or I would call and say, hey, just so you know, I took a full mouth series and I'm going to send that over to you. But we're also a little concerned about a crack on a whatever. And that's in your world over here. So if you could take a look at that. And then I followed up with them. Like, I am really loving this concept that I can call my cardiology specialist that is seeing my patient at the same, we're referring, like, not referring practices, but we're still seeing the same human being.
Yeah.
And just say, hey, just want to give you a follow-up. I'm a little concerned about some isolated deep pocketing that has pretty severe inflammation today. I did X, Y, and Z.
Yes.
And we're going to see them back. I just wanted to let you know that since you are the specialist in their arteries. That
own your space, own your knowledge and what you're doing for your patient. And that also instills confidence in your patient.
Yeah.
That, look, my hygienist or my dental office called my cardiologist and told them that I have these pathogens and I have this perio disease going on, and to make them aware.
Yeah.
And even if you have to send a study over, or you have it tagged on your email, or you say, I'll send you some, even whatever you have to do, at least you show your patient that my information is just as valuable and life-changing for you.
And it would be great if you even gave the patient a copy of what you're sending over and say, just so you know, I'm sending this. This is what's going to your doctor. You may want to follow up with them. And if you want to take this piece of paper in, you have a copy of what they're going to be getting.
And always ask for names.
Yeah.
If you're calling, give your name and then ask for the name of the person on the other side.
Yeah.
And let them know that you're documenting the report that you're giving.
Right.
We have to start doing it. If you're going to be in that medical world, we have to be speaking to each other in the language that they're comfortable with. Because like I brought out in that presentation we did, when you guys talk and you start talking about these pathogens, you start rhyming them off. It's like, wah, 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 wah. Like, I don't understand a word you're saying. And that's an uncomfortable place. And then because I'm uncomfortable, I'm just going to push back and say, it's not important.
Exactly. I do love that. And get the name, because then you can say, follow up with the patient. I spoke to Julia over at Dr. Jones's office on this date. I do wish we took more opportunities to engage with that medical profession, because I personally have no qualms about calling my patient's orthopedist who's telling them to pre-med and saying, hey, I'm following up because, I'm going off the guidelines that say that they no longer need to pre-medicate. And I'm just curious if I'm missing something in their health history that would warrant a pre-med for this, because currently they're pretty healthy orally. And I don't feel that the trauma to their tissue that I would be creating today would be any different than a toothbrush on a daily basis. So what am I missing? And can you help me better understand this? Because I'm really concerned about,
But would you feel as comfortable calling a doctor, like a physician,
and saying that?
Yeah.
Or, yeah.
Not so like a family care physician, you would do that for. But what if it was something that you discovered and you wanted to give the physician that piece of information?
Like an airway thing? Or
yes. Yeah.
Yeah. Yeah. I would now.
Okay.
I would now.
And what would you say to somebody who receives pushback the first or second or third time they do it, to get them to keep trying?
Keep going. Is it from the same doctor or just like in general?
I think in general.
I would probably end up checking my information. Anytime I get pushback, and you and I go back on this, you're like, the moment you get pushback, you're like, I'm going to go ask all questions. Like, what did I possibly miss? Am I not fully understanding this? But the moment that I feel validated, I have no problem being the squeaky wheel.
And how do you validate yourself while you're going through this transition?
Yeah.
Because it's a transition across the board and it's happening, but any type of meaningful change takes about 3 years. So are you willing to push through for 3 years?
3 years, yeah.
Until they realize who you are they'll get to know you in your community. At first, they'll think that you're annoying.
Yeah. Oh, yeah. Yeah.
Then they'll start to do their own research, and then they'll start to accept and listen, and then maybe even start calling you for advice or referring to you.
Right. I think it would be finding a tribe. I know that's such a trendy word, but finding that tribe that could either, and it might not be locally, maybe it's somebody that you call and you're like, they're doing the same thing and they've been successful somewhere else. I would probably have some people in my back pocket which I do even now, where I'm like, I saw this today, and what does that mean? Like, what piece am I missing in this? Or someone told me that the nose is an amazing filter, and I don't need to be protecting it as much. You know, those moments where I'm like, am I misunderstanding? I think I just go find those people that can either hold me accountable, because maybe I'm having that Dunning-Kruger effect where I think I overly understand the information, or that will lift me up and tell me to go.
And I think we had Michelle Hudson come up and give her testimony, because she's been doing it for 15 years and talks about the transition and how hard, but you could see she's thriving. She's loving her life right now because she feels like she's making such a meaningful impact. So you have to stay focused on the goal, and you have to realize that each person, each patient that you have deserves 100%.
Yeah. So
if I called a doctor this morning and he reamed me out and told me I had no business to be calling him about whatever, and who knows? Because sometimes they're rude. Okay. Yeah. And I'm still feeling that shame show, as Brené Brown would say. Yeah. If I'm still feeling that, I need to take a minute to blow that off, to approach my next patient fresh and do the same advocacy for that patient. And I need to keep doing that all day long. And then you're right, having a group of people you go to that say you're not crazy. Yeah. You are correct. You're on the right path. Keep doing what you're doing, and eventually things will change.
Or even the ones that'll push back and say, maybe you just need to change your delivery of it too. It can
be delivery. Yeah. How can we make it a more powerful form of communication?
Which is my issue. Like my delivery sucks sometimes. I get real upset and I get real brash.
I'm brutal too at times.
I think because we care. We want to do
it. But then I have to remind myself that 5 years ago, I didn't know any of this.
Yeah.
And I have to remind myself that I'm still brutal right now when it comes to the pathogens. I would say probably in the last 3 months, I've stopped internally rolling my eyes. I'm sorry. I'm just being, being real.
Do it.
Because I just didn't get it. I didn't get it. And then sometimes all it takes is one thing for you to have your aha moment. And now I'm like, crap, now I got to learn all this stuff because I was missing it. So you never know what it's going to be or when it's going to be that somebody has their aha moment. Just like with you, you were like all cringy when we were first talking to you about it. And then something changed. And so we have to allow people to get there in their own time.
Well, also one of the courses that we took was Steve Anderson from ITOPS, I think, or TOPS, I think, but Total Patient Services or something like that. He's got a really great way of delivering messages to patients and helping you in that verbiage. Yeah. And one of the things he said was there's like that 3-stage, was it Korean Air was finding a way for their pilots because they were super unsafe. They had like the lowest rating in safety for all the airlines. And how do I deliver something to the pilot? And it was like, I'm uncomfortable. Is that right? I don't feel comfortable. I'm concerned. I'm uncomfortable. I don't believe this is safe. And those are words that we say to our office or the offices that we're trying to call. I feel uncomfortable. I'm uncomfortable with
managing this on my own. This is what, right?
Well, that's good too.
I'm uncomfortable managing this on my own. I see evidence of this.
Yeah.
I'm concerned about this.
Yeah.
And I don't think it's safe to allow him to continue without having you see him or intervene. How can you not receive that from somebody? Well, I mean, I think that is powerful. And then the other thing he taught was for your patients. You always say about our patients are not like a receptacle for all of our knowledge. And I've been so guilty of that, of just trying to cram every bit of information I can. And he was saying about asking the patient at the very beginning. Actually, Cindy Johnson talked about this on the Airway series too, that as I go through, and I may see signs and symptoms of things that concern me. Are you okay with me sharing with you? Would you want me to share everything or just a little? And he talked about allowing the patient to be in charge of how much communication we give them, but also that opens up their mind to accept what we have to say, and it makes them a partner. It makes them a partner in this. So I thought that was really good too.
It is.
It's not about what we want to
exactly
give. It's about what they're ready to receive.
And it goes along with even the patient education piece of motivational interviewing, or asking them permission to look in their mouth, permission to give them information.
Yeah, I'm terrible with that.
I'm so much better, and I can't even believe that. I'm so much better. And if I don't, actually, if I'm out of my routine, like I've been traveling, I haven't been in the office for a while, and I go back into it, I've laid them back before, and I always say, I'm sorry. I actually put you back. Is it okay that I put you back? Are you okay? Or, before I start giving them brushing instructions, I'm sorry. Are you okay for me to tell you what I might have found in your mouth that could, you could make a change with or do differently at home?
Well, that's good.
And Uche actually talked about in a tip episode, unconscious competence.
Yes.
So if you get to a point where that's in your rhythm, even when you do get out of it, I think it feels weird.
Feels wrong. Yeah.
Yeah, it feels wrong. And so there will be something that triggers that says, wait, I need to ask my patient first, because they might not want to hear what I have to say, and that's okay.
Right.
Not okay every single time. I will get you, but
well, you document it, and you know what you're going to pick up on next time.
Yep.
I'm going to share that with you next time.
Exactly. And you and I shared, you have the Airway Advocate series.
Right.
And you did one in Charleston. And right before that, I had a real success story with a patient.
Right.
Well, not a super success, but a little one for my corner.
Yeah.
And it was a patient that I saw obvious scallops on the tongue, Malampathi's, like 3, I believe it was, real indicative signs of sleep airway issues. And I asked her about it, and I said, would you be able to get a sleep test with your doctor? I just think it'd be a good conversation to have with them. And 6 months later, I had it in my notes, follow up with her. And I asked her, hey, how'd that go? Did you ever get a chance to go and talk to your doctor? And, I mentioned these concerns last time. And she goes, I had an endoscopy. And when I woke up, they told me I needed to go get a sleep test. And she said, oh, my hygienist already told me that.
Oh, that's awesome.
And I was like, yes. That's amazing.
Yes. What that did for those providers is think, wow, hygienists are looking for this.
Yes.
You made it easier for the next person to come along and have that conversation.
Yeah, exactly.
That's awesome.
And that was only a conversation.
Yeah.
That's all I did.
You planted the seed.
Exactly.
And that's where I think a lot of the hygienists out there who have either been following or took a workshop or whatever, and they're trying, they're dipping their toes in the water. You're planting seeds.
Yeah.
So even if you say one little thing, you know what happens to the brain is all of a sudden now you start to see it everywhere. So you may have mentioned something to the patient and maybe they didn't listen to you. The first time somebody suggested for me to go get a CPAP or get a sleep study, I was like, I'm not going for that. It took 10 years until I went.
10 years.
10 years, because in my mind, I viewed it as, you're telling me I'm overweight. Like it depressed me, because all I knew about sleep apnea was it was something that truck drivers got.
Yeah.
Middle age, overweight. So it triggered something in me. But it was like, then I articles everywhere. I started noticing and picking up and then reading. And so you don't know for your patient whether maybe they don't seem like they're responding right now, but they're going to see it everywhere now.
Oh, yeah.
They're going to read articles. They're going to talk to their neighbors, their friends. And next thing you know, you're having a different conversation.
And I think we can all look at our careers, because I could probably think back on 5 patients right now that I felt so disheartened when they left, because again, they weren't listening to me. Again, I was concerned about an area and they weren't following through, or they just had a procedure and I felt really worried they were going to be right back in my chair having the same issues. And them to come back and say, so I saw somebody else that had it and I've been doing it, and they've been actually successful.
There you go.
Oh, and I think we can all come back and think of a patient. So you don't know who's listening. You don't know where they are while they're listening, like if they're ready to hear it. I keep saying that, we had one person that was our keynote, and he was talking about like the wireless.
Yes.
You and Uche were both like, just like he was spoon feeding you. So you're taking it in. So
yes.
Loved it so much.
Yeah.
And I was like, ugh.
Oh, but you're going to see it everywhere now.
Oh, I am. And I'm going
Mercola.com, by the way. Look it up.
And not if you want to keep your wireless. Don't.
Yeah, Mercola.
Well, if you're like me, I was like, I am not open to this right now. You're going to tell me to wire I just made my house entirely wireless. So
I hate wireless.
And now you're going to like tell me to wire it? Nope.
Well, you can get the little canopy to go around your bed.
I saw that. We've already been joking about my nighttime routine.
Your bedtime routine already.
It is going to be ridiculous if I'm getting into a canopy.
In the Bale Dresden, I hope I'm saying that right, but there was a presentation on Alzheimer's and how to reverse it.
Mm-hmm.
One of the things he said that is super important is home hygiene and dental care. And he was saying that, they are starting to understand the links between the pathogens and Alzheimer's. And they recommend that the patient goes to the dentist, but they realize the dental appointment is not as important as, and I hope I'm saying this right, as what the patient does in between those visits.
Amen.
Okay.
Preach.
So I was like, wait a second. I know these ladies have been talking about this for a long time, about how the patient is managing at home.
Mm-hmm, mm-hmm.
That's what I'd love to see, something like Carrie's program
mm-hmm.
offered to patients,
to
give them the support that they need, the oral health coaching, so that patients can have the education in bite-sized pieces and learn. Because I'm telling you, if somebody in a dental office told me, you have this pathogen, that pathogen, so when you go home, you have to make sure you do it, all this, I would just go home and brush my teeth the same way I've always brushed my teeth, without understanding the impact.
Right.
By not addressing it.
Yeah.
Yeah. And the numbers of people who have that is huge. I just could not believe the numbers they were sharing.
Another point that I wanted to bring up then, because a conversation that we had, so I gave a webinar 2 nights ago, and it was on very much that topic of flipping the script of patient care. Because if you so flippantly go through home care at the very end, and really it's more like, let me go did you want a purple toothbrush this time?
Yeah.
Let me get that floss and your toothpaste and put it in, and it's like you're tossing it at them as they're walking up to the front desk to check out. If there's so little emphasis on that, how do I expect them to put more emphasis on it at home? Like if I personally, as their clinician, their coach, their guide, want them to brush their teeth and clean between their teeth to a point that it properly manages it, and I spend a minute or I'm being super condescending or shaming of like, oh, you still weren't cleaning that area again, like I talked about last time. If we're not putting that emphasis on it, how dare I demand them to do it at home?
The thing is, we just don't understand. We tidy our homes, we clean, we do maintenance, and twice a year we do like a spring and fall major clean.
Right.
And so we view our
Dentistry
dental provider like that. Every 6 months I go for my major clean,
mm-hmm.
and then I'm just maintaining until my next major clean.
Exactly.
We just don't get it. And so I'm hoping we can do a lot more education on that and get it out to the public, because you guys have like this whole secret society of knowledge here that we just don't, and it's accessible to everybody. But like, okay, let me ask you, Carrie, have you met any other nurses at this conference?
No.
They had the room full of 800 people, and how many nurses here? And I'm the only person that puts up my hand.
Your hand up, yeah.
So that's a huge problem.
It is.
When we are the biggest group of healthcare providers globally,
mm-hmm.
and we're not getting this knowledge.
Yeah.
We go to our own nursing conferences, getting the same information disseminated the same way year after year. And we have certificates we have to get and keep up as the same information. We're not expanding our knowledge. So I want to bring hygienists to the nursing conferences. I want to be having these conversations on the big stage in front of those groups, because I guarantee you it's going to blow their minds.
Yeah. And I think that's a good point. And I sent you that article on the nurse that was starting to do oral care in the VA hospital, and how right now in our hygiene community, that's a real touchy subject. Some are like, praise, thank God, it's about time. And the others are like, how dare you try to do our job? Like, we've been trying to say this forever now, and they're getting really up in arms. But also keeping in mind the VA has its own little private world. So I don't think a hygienist could get in there anyway.
Okay, so let me ask you this. Is the mouth attached to the rest of the body?
Mm-hmm.
And a nurse is responsible for the entire body?
Mm-hmm.
So let's hope the nurse has some basic understanding of the mouth. I think I've shared with you, I know I have, that for a lot of, I'm embarrassed to even say this. That's why oral care consists for the most part of a swab dipped in mouthwash.
Yeah.
And rubbed over the surface of the teeth and the tongue.
Mm-hmm.
In terms of good oral hygiene, that we are brushing the teeth and getting the patient to spit, or we're suctioning out, that's few and far between.
Yeah.
Few and far between. And we console ourselves with the idea that we're saving lives, and all of this other stuff we're doing is so much more important
than that.
But now I'm beginning to realize all this other stuff that we're doing can be sabotaged by the fact that we're not addressing the oral pathogens.
Mm-hmm.
But that literally, I'm only beginning to get that in the last 3 months, even though you've been saying it for how long? So rather than be like, they're taking our job, no, help them.
Yeah.
Support them, teach them.
You know, I think it honestly comes from a place of frustration, because there's so many that really want to be in the hospital, and now they're not able to, just because of the scope of practice and working under general supervision and direct supervision, just whatever the state is.
You want to be in the hospital?
I would
like
love
working in the hospital setting.
I actually would have loved that.
Yeah.
Which is why I did my thesis on it.
Yeah.
Because I wanted to be that hygienist that was going from patient to patient doing the oral care, like a respiratory therapist was going.
All you need to do is do up a proposal, get one hospital to let you come in and do a pilot study.
Yeah. So which we do have some hygienists in the country doing something like that. They got grants for it, because you absolutely also have to find a way to fund yourself too. But the nosocomial infections, VAP, ventilated associated pneumonia, was one of the highest ones that had morbidity attached.
Well, if you have a proposal in place, or if your listeners do, contact me. I'll get you in touch with the person that helps you get the funding.
Yeah, that's great.
Because there is funding for that out there. It's just you have to know how to find it.
Yeah, yeah. And I honestly think that's where it's really, but also then you go into these hospitals and they don't know what hygienists even do. So there's that, hill to climb. But single time I do my mission trip, the reason I do mission trips that are not just dental, but they're medical, is because of this reason. On our bus ride home from seeing people, we're all in the same open air facility, and they're seeing what we're doing. And I'm literally getting up and walking over to the doctor who treated the patient, and I'm saying, I'm seeing a lot of acid reflux in their mouth. Could we talk about maybe also 30-day supply of meds? And they're like, wait, what? What did you mean? And then by the Wednesday, they're coming over and grabbing me because they just saw something in the mouth and they don't know what it is.
Nice.
And most of the time it's like tori.
That's nice.
That little bony protuberance in the roof of the mouth. But at least they're coming over there.
Yes.
And then on the evenings, we are talking about, they're like, wait a second, you do that? I'm like, yeah. And it's usually the hygienists that are on there, like just the whole time.
We need more of that.
We do need more of that. But I think they have no clue what we're doing. So they, of course, aren't going to appreciate our existence, but you need to charge through, and
you need to own it, and see about going to ground rounds at the hospital.
Oh, yeah.
See about asking to speak at Nursing Skill Day. Put in a proposal to the nurse educator at each institution. Look at your local hospital.
Mm-hmm.
Phone switchboard. May I speak to your nurse educator? They're always looking for interesting things to bring into the hospital.
Okay.
Say, look, I'm a hygienist. I specialize in whatever it is you want to speak about.
Mm-hmm.
Can I send you a proposal to come and speak at your skills day about how this relates to that, or about how to screen for this? And, but think outside the box of how to reach out to your community.
Mm-hmm.
And that's something we want to support people through.
Yeah.
That's one of the things. So we have a group of people together, a group of hygienists and nurses that we are, starting to do that through the Continuing Education Alliance.
Mm-hmm.
It's a nonprofit organization that's the umbrella group for what we're doing. but I want to help. I want to help you guys get to where you feel like you're seen, you're heard, you're validated.
Yeah.
Because what you do is life changing, but that knowledge needs to get out there.
I definitely felt like very early on in my career jaded by the shunning of the dental hygiene community by nurses.
Yeah.
Because in my particular school, I took every micro anatomy, organic
like
chem with them too.
Yes.
Like, cause we were in the same community college that had both programs.
Right.
And then we got done with our prerequisites and diverged to our particular specialties. And it just never felt like I have to do blood pressure. I have to do A1C. I'm doing these things. I'm embracing talking about diabetic meds and, sending them and referring them back to their physician. But I can't get that reciprocated.
Did you spend the last 6 months of your program with courses teaching you to own your place in the medical community, to stand up and realize your power?
No, not.
I mean, we had a lot of those. The last part of our course is how we are influential in making change.
That's great.
We are the agents of change. You need to own and recognize who you are and what that stands for. So I do think that there's a difference for that.
Yeah.
And whether it's good or bad, I mean, it helps us as nurses, but maybe it doesn't help us to be as collaborative as we could be.
Oh.
Because we're here.
Yeah.
I'm like, it's horrible. I'm saying how it is.
No, that's absolutely the truth.
We're given that permission.
Mm-hmm.
If you're not given that permission, where are you going to get it?
Yeah.
You have to self-actualize that, or like you said, become part of a tribe that empowers you and gives you permission to own your place.
Yeah. That's good stuff. So I'm curious, what has changed for you in the information since we delivered it at the beginning of the year? Has there been any really amazing things that we need to update anybody who would follow that Airway series? If they're like, what else is new? I think the bruxism thing might be a nice one.
I think definitely looking beyond the airway, if you could put it that way. So yes, it's airway. You have to screen for those physical characteristics that indicate an airway issue. I am talking a lot more about the cranial nerves.
Oh, yeah.
About the face, facial expression. Your brain communicates to the world through your face. Mm-hmm. And then how your face reacts with people and experiences, your facial expression, definitely sends a message back to your brain. That becomes altered. Mm-hmm. For many different reasons. One of it is facial asymmetry, orthodontic work, airway issues. We also have a lot more information about vitamin D through Stasha Gomanak. Yeah. Looking at bringing all of these pieces together to start to get a better understanding of the physiology of how we work.
Yeah.
Take away whatever you thought you knew. All these interventions we're so good at. And let's just get back to thinking about how does the body work? And the brain controls everything. So Lois Laney's course on the neurosequencing blows your mind. It's overwhelming. The same as Stasha's stuff is overwhelming. But I want to really help to break it down, start with baby steps, just like we did with Airway, and start adding these pieces in together so that we all grow in knowledge together.
Yeah.
I think that's probably my goal for this next year, is to produce a lot more content in simpler forms that people can take and digest and learn in their own speed, so that they feel more comfortable delving into these medical issues with dental solutions.
Yeah. I've said it for a while, but really putting more value in going to different types of conferences.
Yes. Yeah, you've come to a few different ones this year.
Yeah. But even, so I kind of was just in dental, right? Like I was always going to my hygiene, but now maybe I need to go to perio. Maybe I need to go to restorative, but now I'm like, oh, I got to go to these airway courses. I need to go to this AAPMD. I need to go to functional medicine and really go tell people. Somebody said yesterday, like, oh, are you just a hygienist? And
what do you mean just?
Yeah. And I'm trying not to also take offense to like things like that, but she was a speech language
Yes.
pathologist, and I'm sure has been jaded by a few hygienists that have not done well by their patients, especially in the oral myofunctional world.
Yes.
And so when we're here with dentists and doctors and nurses and like, oh, are you just a hygienist? I'm sure it was like, are you just, or are you doing any of the other things?
I think she meant, are you a hygienist or are you a hygienist / myofunctional
something
therapist?
Exactly.
Mm-hmm.
Exactly. So, but it was, I want to go and say, yeah, I'm a hygienist. I'm here because I want them to be like, oh, why would a hygienist want to be here? I'm like, oh,
yes.
Well, let me have that conversation with you.
Let's have that conversation.
Yeah. Yeah.
Yeah. I've had several people say to me, what's a nurse doing at a dental conference?
Mhm.
And I've just started saying, I'm sorry, is the mouth attached to the body? Because I'm interested in the whole body, the whole person.
Yeah.
And they laugh, like I say it in joking,
Yeah,
right?
yeah.
Because they always accuse medical of ignoring it.
Mhm.
But then when I'm
When
here trying to
medical
pay
comes.
attention, you're like, what are you doing here? So we've also gotten used to our exclusive little
Yeah.
communities.
For sure.
We have to branch out. And here's what I don't understand.
Mm.
If you want medical and dental to collaborate, are you telling me as a dental provider, you don't know a nurse? You don't know a physician? You don't know bring somebody with you. I would like you to come as my guest to this conference.
Mm-hmm.
Why aren't we bringing our friends?
Yeah. No, we should.
I don't understand that.
We should. Any thoughts for 2020?
2020.
Call to action for 2020?
So as far as for the Foundation for Airway Health, we had our launch of Global O2 Day.
Mm-hmm. October 2nd, O2.
O2. So now, October 2nd, 2020 is O2 backwards. So they want it to be huge. So one of the things we're trying to gear up for is to have all these practices, all these people out there that are getting on the airway train
Mm-hmm.
and they're looking for these signs and symptoms and recognizing it. We want you to show us what you're doing. How are you reaching out in your community? Plan something really special
Mm-hmm.
for your office or your community for that day. You have a whole year to plan for it. So that's a big thing, is the global awareness that we're getting. And the Airway Advocate hashtag, that has gone global to 14 different countries around the
Nice.
world. I have people reaching out to me asking to have these workshops in their countries. And that's really exciting for me to see that the power of social media, what we're getting this message out.
Yeah.
So where it used to take about 10 to 20 years to make a change in healthcare, we are able to do in 3 to 5 years now. So don't give up. We are like at that tipping point,
Yeah.
which is really exciting. I think one of the biggest things for me this upcoming year is the collaboration. So, it's ceaeducation.net. You're going to see different courses on there from people from your world.
Mhm.
So, a hygienist, myofunctional therapists, nursing. We're going to be doing cross education and having those modules available for people. So definitely bruxism will be on there,
Mhm.
looking at it in depth. If I can get Gilles to help me out with that, so
Yeah.
we get his latest research, we'll do that.
That'd
He's
be
from
very
Canada,
good.
a
Yeah.
Frenchman. So yeah, and we're going to provide you with a lot more tools.
Okay.
So for example, patients who come into your office with pain,
Mm-hmm.
we have the Speed to Treat home healing kit
Yeah.
that you can intervene right away. It's oral facial pain specialists guide people through their home care for pain.
Mm-hmm.
And then the tools that they need for it are in the kit. Positional therapy products. So if you're doing oral appliances in your office, if you were to look at the sleep report at the bottom, it'll say recommended CPAP, oral appliance therapy, or positional therapy.
Mm-hmm.
The research shows that an oral appliance and positional therapy work as good, if not better, than CPAP therapy.
Mm.
So if you're providing oral appliances, you should be providing the positional therapy as well.
What does that even mean?
It means you keep the person sleeping on their side.
Ah.
So CoPAP pillow is awesome for that. We'll be providing some screening tools that a hygienist could initiate to say, look, I'm seeing these signs and symptoms. I'm going to send you home with this screening device
Mm-hmm.
so that when the patient comes back, you've got that information to have a deeper conversation with them.
Oh, that's great.
I personally feel like people are inhibited from having a conversation with somebody if they don't have the tools to take that next step.
Yeah, I believe that.
So I'm trying to find as many tools as we can to help hygienists to have the conversation and act.
Yeah. I think for me, the tools are, I think I got really hung up on at the very beginning on not knowing who to send these people to. Not even that I didn't have the tools, but I didn't have the people. And so sometimes I look back now and I think I would have felt better had I started having those conversations, but also parallel to that, sought out the people in my community.
So I think there's two things that, yes, you definitely want to build your network, and that will grow organically as we're doing the things we talked about at the beginning with our reports and calling. But the other part of it is, I think, recognizing there's so much that you can do in your own office.
Yeah.
I think that's what people don't realize. So I want to start demonstrating that. You can help so much with a person's sleep, and sleep is where they heal, where they decrease inflammation. It helps everything that you do, from implants to perio to whatever, to decrease inflammation. So showing you, so for example, somebody comes in pain, 85% of those cases that have facial pain or TMJ, quote unquote, 85% of those people can resolve with minor things done in your office. They don't all have to go to a specialist, but having the confidence to have that conversation and say, I'm going to work with you. We're going to give you this to try. Come back in 2 weeks. We'll see how you're doing. But within 2 to 4 weeks, with these little steps that we'll teach, they should resolve. And if they don't, then you can refer them. But it drastically cuts down on this feeling of, I don't know where to send them to, so I'm just not going to have the conversation.
Exactly. And that's a problem, because the worst thing, and I've said it for years, I never wanted a patient to come back and say, you never told me that. That has been a fear of mine since the very beginning.
Okay, but they will, because you only could tell them what you knew at the time.
Right.
And later on, you learned something new. And if they hear it from someone else and come back to you, say, you know what? I'm just beginning to learn myself. I'm so glad somebody pointed that out to you, and I'm learning too. Let's talk about it.
Yeah. And I guess I should clarify in the sense that I that definitely is 100% the case, but also I don't want to never have that conversation.
So you mean more like you did know, but you were apathetic to actually have the conversation. I see what you're saying. Yeah.
Like, I never want, that was a huge fear of mine, but also a fear of not knowing and the patient coming back and telling me something. So that has always been my go and find the information. But I probably would have felt shame for that because I didn't have the information, where instead now what you just said, I'm just learning this too. And I'm not going to know it all, but I would love to learn what you're talking about. Tell me more.
None of us want to look stupid.
No.
All right. None of us want to look stupid. I think the faster you can get used to feeling stupid, the faster you can deal with that, the better provider you'll be for your patients. And I think Brené Brown, she wrote The Gifts of Imperfection. I thought it was just me, but it isn't. I read that book and it completely changed my perception on that, to be more willing to say, I don't know. I don't know. Or I made a mistake, or just own it.
Yeah.
And you neutralize that visceral response and that shame we all have that goes back from when you're in grade 1 and you answered the wrong question. You gave the wrong answer.
Yeah.
And everybody giggled at you and you felt like an idiot. We have to get over that because everything is changing so quickly. We can only do the best we can do.
That's right. If you had one thing from this conference that you learned and we were like, that's good stuff, you got a one?
I think the one thing I've heard at so many of the different presentations is the pathogen piece. And the reason I keep coming back to that is because I feel stupid right now. So we're talking about...
You're like the smartest human ever.
I feel stupid right now because I wasn't practicing what I was preaching. I'm telling everybody else to be open to accepting this new information. And I want everybody to get excited about what I'm teaching. But I was closed off to what you guys were saying. And it's reinforced over and over again. So like I'm saying, you guys planted the seed and I wasn't initially receptive, but now I'm seeing it everywhere. I'm hearing it everywhere. And my conscience is beating me to stop being so proud that I can't take in new information. So yeah, I think I'm kind of going home from this conference really humbled and feeling a little bit embarrassed that I didn't respect you guys enough to really listen to what you were saying and take a minute to digest it.
Yeah.
Yeah. That is how I'm going home tonight.
I'm going back to that idea that, it wasn't, somebody said it in a way that made sense to you. So it's like, were you not open to it, or it just didn't?
It didn't make sense to me. And so I had a couple conversations. First of all, I was listening to Mark Hyman on the Broken Brain conference that he has. It's online. He talked about Alzheimer's, and he talked about the inhalation of these pathogens you guys talk about through our nose being drawn up to our rhinoencephalon system and disseminated through our brain, creating that sticky matrix for amyloid and tau to bind together. And that made sense to me. I was like, okay, now I can understand how it gets into the brain. But then also I had a conversation with Cindy Johnson, and she was explaining about, the pockets and the bacteria being held in there and the bleeding, and how, of course, the blood acts as a capillary action to draw whatever bacteria is there into the bloodstream.
Mm-hmm.
So of course it would get into the body and into the vessels and and I just never pictured before. I'm thinking of an intact mouth with these organisms sitting on your tongue or on your teeth. I'm thinking it's no big deal. You swallow and I didn't understand how it gets in and acts on a systemic level without a portal of entry. It was just the way that it was explained made sense to me. Now I'm like, of course, if there's a portal of entry, it can cause damage. So I don't know. It was like all of a sudden I was like, oh,
I see now.
Okay.
But this is also, I think, why it's good to get just a little, dip your toe in a lot of different things, because then maybe you could find that way to open their mind. And I'm thinking of a patient that I had that was a nurse who did diabetic research on patients with diabetes. She did that her whole career. And she sat in my chair for the first time and she said, I don't get bone loss. I have pretty good genes.
What?
And she's a smart nurse, right? Like understanding of it.
But medicine right now is, everything is your genes. Do you have a genetic risk factor for that? Oh, it's your genes.
It's your genes. Yeah.
We're not talking about epigenetics.
Right.
And that's where I feel like we're not offering hope to our patients. What we learned this weekend is you have the power to turn on genes and turn off genes.
Yes.
So don't just tell me I have a gene for it. Is that gene on? And how am I going to turn it off?
Turned on by environmental factors or lack thereof.
Right.
But with this particular nurse, I knew that because I did have that little quick get to know you conversation. What do you do? You're retired. What were you doing all your life? And I was like, okay, so you've been doing diabetic care. Do any of them ever have like bed sores or anything with biofilm? And she's like, yeah. And I was like, oh, great. So like you've curetaged and you've done wound care.
Yeah.
And she's like, yeah, oh yeah. Like, so I was like, I'm just curious if that person had a pretty good, they don't ever get bone loss around their teeth. Do you think they could have fought that biofilm once it got to the bone of their leg? And she's like, no, that definitely would not. No, it would have eaten right on through their leg if you don't. That's how gangrene happens. That's all these things. And I was like, that biofilm is almost the same, but very similar to your teeth and your mouth and your gum tissue and your jawbone. It is no different, because if I don't debride this infection, if I don't curettage in a way, quote unquote, if I don't manage this biofilm that's in there, it will erode your jawbone. That's what's happening. And she was like, done, sold, got it.
Yeah, I didn't realize that.
I completely get it. And I was like, it's biofilm. Biofilm. I mean, it's of course going to be a different community of biofilm.
Yeah, a different But
we understand that biofilm And if you're a nurse and doing wound care, like you understand that.
Yes.
But I had not known anything about wound care until I went on my mission trip where we had a whole team for wound care.
Yeah.
And I was like, what the heck y'all doing over there? Taking splinters out? Like, I don't know what's happening.
So listen, if you're going into a hospital, that's how you have to approach it. Because we get that. We understand wound care. We get clinics in that. We have in-service training. We've got all that. So if you approach it that these are wounds with bacteria, except the location is in the mouth, around the teeth. I mean, you're talking about this right now. This is like the first time I've ever heard.
What?
That. No, I'm serious. For you to say it like...
Am I on the right track from the nursing perspective? Like if you didn't clean a bed sore.
Of course.
It would just...
Of course, but we don't view the mouth that way. We view the mouth like it's benign. We really do. I'm still just sitting here digesting what you were saying.
That's great. Maybe that is our way in.
It's wound care for the mouth.
Yeah. Because if we let that biofilm sit there, that's going to happen. It's a wound. There's a really great German dental software program, and it has a hand that stays on the screen. And every time you give a bleeding point in the mouth, there's a wound on the palm of the hand that grows.
What?
Like from a computer stamp, like it's animated.
Yeah.
So every time you're saying this is a bleeding point, this is a bleeding point. So if I said generally, it's like this is how big that wound would be on your hand by seeing this much bleeding points and how aggressive. And if I add pus to it, if I add all these things, it shows if that wound was anywhere else on your body, what that would look like.
Yeah.
Because they're small wounds in the mouth. But now they're coming in.
It's insane.
It's a good program. I wish we had that in the US, but this has been really nice to catch up.
It has been. And I want to thank you for having me and Cindy on the Airway series at the beginning of the year. I had so much positive feedback from that as well.
I am so glad. It's been one of everyone's favorites.
Nice.
And Cindy Johnson, who is not on here, if you need a consultant in your practice.
Yes, she was going to be here. Unfortunately, she couldn't make it. But no, definitely. We're doing a lot of outreach together for practices that want to implement sleep. And she's the perio queen. So she does what she knows and I do what I know. And just to try to help bring it together.
Yep. No, so check her out. You will have your information in the show notes as well. Airway Advocates, and then facemypain.com. What else? Correct Sleep.
Yes. So Julia at facemypain is .com is a great way to reach me.
Okay. And
then connect with me on Facebook through FACE, Functional Airway and Craniofacial Education. So
perfect. Well, thank you again for coming on, Michelle, and bringing nurses and hygienists together.
That's great. Say hi to Andrew. It feels weird with him.
I know, right? Well, we hope you enjoyed that recap with Julia, and you definitely heard some background noise because we were at AOSH, or at Collaboration Cures. I always want to call it AOSH, but it was the whole big thing, Collaboration Cures. And we're going to be at quite a few other shows in 2020, which, we kind of chatted about 2019 at the beginning, but I think we're both excited for some things to come in 2020.
So we have the staples, right? Like, what are our staples that we go to? Voices of Dentistry.
Chicago went, Voices of Dentistry.
ADHA, Under One Roof.
RDH, yeah.
And then
Greater New York.
And Greater New York has, like, the last couple of years kind of made it to the list. This year coming up, and last year was awesome. Look, I mean, we had Australia. Oh my gosh, that was amazing.
Oh yeah.
Okay. But so this year, we're going to do a couple other shows in addition to kind of the staples that I'm looking forward to. Last year we did Yankee, and I think part of the team's going to go to Yankee again this year, it sounds like. So there may be an opportunity for that. So it's Voice of Dentistry and Yankee are both in January. And then Chicago Midwinter will be in February. So I know it's at the end of the year, but if you are planning to go to any of these ones that are coming up quick, let us know.
I'm also going to OSAP.
That's right. And that's going to be in between. It's the OSAP boot camp. And that's going to be in between Voice of Dentistry and Yankee. And it's like a Monday. Is it a Monday, Tuesday, Wednesday?
Yes. Monday, Tuesday, Wednesday.
So it's a during the week kind of a situation, but it's amazing. If you haven't heard much about the boot camp, head over to the Dental Podcast Network And Michelle Lee has the official OSAP podcast on there. And she talks about a lot of the things that you'll find at the boot camp and some of the reasons why you should go to it. And she does an amazing job. She's, by the way, as another little side note, one of the most amazing podcast hosts I've ever heard in my entire life. She is so good. Fantastic. Great guests. Her voice is awesome. Wonderful. So go out, go over and check her out. But then we have, and that's February, March. Michelle, you're going to Hinman in March,
Hinman. Right? Yep. It's shameful that I have yet to go to Hinman. It's literally in my backyard. Like, it's in Atlanta. It's drivable. It's there what in the world? But it's always something else going on that we're somewhere else during that time. But yeah, we'll be at Hinman. We'll actually have like a podcasting area. So I'll be doing some interviews there with some other podcasters, which will be fun, but we're going to be repping the hygienists. So if you're going to be at the Hinman show, please come hang out and show them how awesome hygienists are. That would be great.
And look, we like transparency here. We tell you guys, we overshare. One of the great things about the Hinman one is that the Hinman organizers invited us to that event. I want to give that recognition for just a quick second because they value education. They value the different ways that education can be obtained. And I want to applaud them for that because that's unique so far in the conference world.
But also there is a trend. 2019 was very interesting because when companies approached us, they were saying, we want to start engaging the dental hygienist. That was being said over and over and over again. So if I could say anything, like a call to action for our profession is show them how smart you are, show them how engaged you are, show them that you understand the business side, or that, you ask smart questions, that you really are, what's the word I want? Like, you're really the take action kind of person that they want to talk to.
Hyper engaged. You are a leader. You are a change maker. All of those things that they're looking for.
Because I think they sense it, and now they're testing the waters. Like, is this really true, what everybody says about hygienists? And like, let's slap them in the face with how engaged we are. Like, I think that would be awesome. And that's like sharing this podcast, being more active on social media, being more active in the science side of everything. I think that would really go the distance with some of these companies.
If you feel like you're too bashful or afraid to maybe contact some of these companies, might I suggest trying to have these types of the same conversations we're talking about, showing that you're smart, showing that you understand the metrics, showing all these things to your owner doctor, to your lead hygienist in your office, to the office manager, to any of these other people. I think that's a great way if you are not quite ready to make it onto a bigger level. Like, let's start in the office, changing and radicalizing that perception of, look, you're only there to scrape on teeth. Like, change that whole perception. Most of them already know it, but we're not demonstrating that all the time. We're a lot of clock in, clock out kind of people sometimes. So let's change that. So that's through March. And then we have a little bit of a break. We're going to be at ADHA again. We're going to be at RDH Under One Roof, which is in Denver this year, right? So that'll be a little bit closer to my home. So I'm very excited about that. So I don't have to travel all the way across.
And I got a direct flight, and it's going to be great.
Are you taking Spirit again to Denver?
That's Frontier.
Frontier.
Again in my life.
Oh my gosh.
Never again.
That was a mistake.
I've officially jumped ship from Delta and moved it on over to United. Didn't think that would ever happen.
Oh my gosh. Talk about changes in 2019. Oh my gosh. Then nothing has been more phenomenal than that. Now, it did take me 4 years to convince you to switch over to United. And it was the worst time to change to United since they're changing all of their status stuff. But whatever.
I know. I would choose that time. But it's all right. It's okay. I'm getting more direct flights. That's fine.
Yeah. No, that's good. And then we have lots of other things. There's going to be, you have to check back on the podcast. I can't remember all the stuff past 6 months. So
it's true. But we would love for you guys to share. Tell your friends. If you need us to help you in some way, you're like, hey, make a social media post so I can put it out there, or whatever it is. Like, we have grown organically from very beginning because of you guys. And we absolutely appreciate that. And it's not for us, really. It's like we have such amazing guests. Like they need to be heard and heard often, right? Like, so if you were just struck by a particular podcast, please share it. Please put it, if you're a presenter, put it in your presentations. If you're an educator, put it in your, talk to your students about it. If you are a student, tell your faculty about it. Like we would just love that support, so that we can have more people come on the podcast to deliver the information to you guys. And the more we grow, the more we can do that for the world of dental hygiene.
Oh, show. One of the only other things that I really want for 2020, if I'm making my wish list, I think that I would really like the Dental Podcast Network to grow. So we've referenced this in October, we launched the Dental Podcast Network. So it's 10 shows done once a week. And they're just really amazing people that are putting it out there.
So true.
But it's such a wide variety of things. So if you're listening to our podcast and you're like, look, not every single thing applies to me because I'm in a DSO and all this other stuff I can't do anyway. Well, we have a DSO podcast over there on the Dental Podcast Network. If you're loving infection control and you love everything about OSAP, like I mentioned earlier, we have Michelle Lee doing the OSAP. We have everything that you can think of on that channel. So I would love to see that one grow. I would love to see it grow organically, just like a Tale to Hygienist has. But I want to see it grow in force, though, because we have a nice little group of people here that can really share very specific messages to their doctors, their assistants, their fellow hygienists, whoever it ends up being in their office.
You're right. They're just amazing hosts on that. And they bring great guests as well. And it's all about just making us more informed, but in a easy way. Like while you're putting your makeup on in the morning, while you're driving to work, while you're cleaning the house. I mean, we had a really fun listener tell us that her family for her birthday got her AirPods because they were tired of hearing the podcast on speaker in her back pocket while she cleaned the house.
That's so good.
Yeah. So you can listen to it in all different ways and times. And so tell people about it. Tell them how, if they can't find it, help them download it.
Yeah, exactly.
Thank you to PDT for all the sponsorships and CE Zoom, because a lot of our podcasts are for CE credit, and it's because of them. CE Zoom and PDT. Thank you so much for 2019.
Thank you, everyone, for listening. Thank you for putting up with all of our shenanigans over this year. Here's looking to a shenanigan-filled 2020.
There you go. Sure.
Okay. Well, look, more of the same to come in 2020. That's what I want.
Lots of growth, lots of education, and hopefully just seeing our profession rally together and be seen as a profession and not a freaking vocation. Let's get at it.
Which is, before we go down that thing, we're going to end this podcast because that's another 20 minutes
of Michelle ranting.
Yes.
All right. Well, we hope everybody has a really great week. Merry Christmas, happy holidays, happy New Year, all that jazz.
Goodbye, everyone.
Bye, y'all.